Hi everyone, I am Kimberly, the 5-Minute NP. The 5-Minute NP was born out of my belief that small, incremental changes can drastically change the trajectory of your life. Our genes do not have to determine our lifespan. My goal through this podcast is to act as a roadmap that bridges the gap between knowledge and action, leading to you living your healthiest, happiest, longest life. Welcome to the 5-Minute NP podcast. Hi everyone, it's Kimberly. Welcome to the 5-Minute NP podcast. Today I met with Matt Smith, team physician and orthopedic surgeon for the St. Louis Blues hockey team, as well as Washington University orthopedic surgeon who specializes in youth sports. He discusses what it's like to work with such high-level athletes as the Blues. In addition, he discusses youth sports, what ages it's appropriate to begin training, common injuries such as ACL and growth plate injuries, and he discusses his thoughts on youth football. Stay tuned for an excellent episode. If you're enjoying these podcasts, please feel free to subscribe and share them. I look forward to bringing you diverse topics about all aspects of health that aim to help you live your healthiest, happiest, longest life. Welcome to the 5-Minute NP podcast. All right, so I am here with Dr. Matt Smith, orthopedic surgeon at WashU and team physician for the Blues, and we are going to find out more about him and learn about youth sports. So, how are you doing?
Good. Beautiful day here in St. Louis. Glad to be able to provide some information to everybody who's watching.
Yeah. So why don't we start with just when did you get started? How long have you been practicing, and how long have you been with the Blues?
Yeah, so I moved here to St. Louis from doing a sports medicine fellowship at University of Michigan in 2009. So this is 11 seasons with the Blues, 11 years in St. Louis practicing primarily at WashU doing sports medicine, which means we take care of all host of athletes. So it doesn't mean you're only an athlete if you're young. We see people all the way up to 65 years old for sports injuries. Everyone who wants to stay active and be fit is an athlete in my mind.
What's it like working with those high level athletes like the Blues?
They're fantastic. I think the myth about some of the pro athletes is that they're any different than the rest of us. They are incredibly gifted at what they do. They work really hard at their trade. It's not like they wake up and get out of bed in the morning and suddenly become an amazing athlete. They're working at it, but they're just like everyone else. They want to have the ability to participate in the thing that they love doing, and they're actually quite easy to take care of. They're very respectful. They really appreciate the help that they get.
I bet a lot of pre-training stuff goes into what they do.
Oh, absolutely. No, these guys are, they're constantly working on their bodies. I think, they'll take a little bit of a break at the end of the season just for some recovery, but they start training very early. So again, if the season starts in September, most of these guys are starting their training regimen sometime in, late June, some earlier. Some never even stop it. I mean, it's hard to get out of shape and get back in, but they really start pushing themselves early. So they don't want to just get on the ice and go 100 miles an hour without being ready for it.
Right, no doubt. Well, I think that is a good thing to do as far as pre-training, and which kind of leads me into the topic of everybody's kind of been dormant since this whole COVID crisis. And so I thought we should talk about transitioning to youth sports. How can these young athletes start to prepare their body after they've been kind of laying around for a while to prevent getting hurt?
It's a challenge because I think there's two things if we always look at the silver lining or the positive that comes out of a situation, which is hard to find many out of this situation, but for some of them, the mental reset button has been hit. So a lot of these kids have been playing baseball and soccer, and they've been going year-round for years, and they've never had a chance to do something unstructured and learn how to do their own sort of games. And I think for some, it's helped them learn what they love. I mean, sometimes getting away from your sport makes you realize how much more you love it. Sometimes you get away from your sport and you play a different sport because you can only go shoot hoops in the backyard or throw a baseball. You're like, wow, I love that. So it's been good from that standpoint. But yeah, you're absolutely right. When you've been sitting around doing nothing and then you have to go right up and ramp up to 100 miles an hour, It's a risk. I think it's a risk for adults. It's a risk for kids. I think the training regimen has to be really a big part of getting these kids back together.
Yeah, I know even with my own kids, I mean, it's been so structured for so long. And so it's been tough getting out of that schedule, getting out of that structure. You know, even my 18-year-old, he was walking through the kitchen the other day. He's like, oh my gosh, I think I'm getting a gut. I'm like, well, better get after it. You know, you're 18, gonna play baseball, you know? Um, well, with the youth sports, you know, it's been crazy because it's been such an overplay, undertrained thing these days, I believe. Most youth clubs, they spend a lot of time on skill development, competition, playing games. I don't feel like they're spending as much time on muscle and body development. Um, so for parents out there, what would you suggest? How long should these kids be pre-training and getting their bodies ready for sports?
I think it's a little bit dependent on age, to be honest with you. So if you're having a kid who's like 7 years old, going out and play, just let them have fun. I mean, nobody ever gets a scholarship at 7 years old.
Right.
And you can't, and truly, you don't really know how good your kid is going to be until they hit puberty, and they start to develop their more adult-like muscle strength, and that's when you can really start to be more aggressive about training. What you don't want to do in younger age groups is really push these kids so hard that they want to quit playing the sport. So there's really the physiology of a kid who hasn't hit puberty yet. You know, you can develop some brain pattern firing, so they, you know, say for golf, for example, they can work on their swing and they can learn that pattern of swing, but they can't really get strong enough to hit the ball 300 yards. Right. So I think the training really has to be focused more at the, you know, 14, 15-year-old group. And a lot of it has to do with conditioning. I mean, I use the analogy, if I haven't run 1 mile, I can't run 26. And
Right.
you have to work to develop that skill. You have to work to develop that conditioning. And again, a lot of kids, they come off, you know, summer and they haven't done much, and they jump into their sport full tilt, and they get injured.
Mm-hmm. Well, what level, like what age group should these young kids start lifting weights? I know some of the kids Brett's age, your kids' age, 11, 12 years old, are lifting weights and doing conditioning and training programs. And that just is kind of a lot for that young age.
Yeah, again, I think as they start to physically develop after they hit puberty, I think lifting weights is probably more reasonable. But yeah, if you start lifting weights too early, again, if the kid's still really skeletally immature, they still have their growth plates open. Repetitive heavy lifting can really stunt the growth of young athletes. So again, body weight stuff. If you want to do some functional movement things, you know, working on core and glutes and that kind of stuff that'll make them faster and stronger just in general, I think that's a good idea. But I would stick with body weight stuff and just making sure that they're, you know, A, enjoying the game, and B, just pretty well conditioned. They don't have to be, you don't have to be lifting weights at that age. Again, 13, 14 years old, I think you can start thinking about it. But even then, I think more 15, 16 is probably safer.
That's really great information, because you know that there's so many programs now focused on these kids doing that high level training young, you know? Yep. I mean, Brett, my own son, he's been invited to a few of those things. I mean, he's too much of an outdoor kid, wants to have fun and play the sport, but some of his friends are in there doing, you know, training, you know? So it just seems like a lot. So I've heard you talk about multi-sport athletes, and I agree the importance of it. I think it's huge for kids, developing different muscles, different movements, interacting with different coaches and teammates as well. But what about as far as these kids doing all of these multi-sports, playing all of these different games in a day? I mean, what do you feel like the impact on them, you know, as far as, I mean, that's a lot on these young kids.
Yeah. So I think playing multi-sports, I think of it more as being in different seasons. Mm-hmm. So do I think it's a good idea to go play on a hockey team and then run over and play 3 basketball games in the same day, and the next day play another hockey game? No, I think that's too much. But do I think you should be playing soccer year round or baseball year round? Absolutely not. So the injury data, there's some pretty well done studies that track injury rates, and when we have started seeing sports specialization happen at an earlier age, we're starting to see the injury rates in those kids just skyrocket. ACL injuries are way up. Tommy John injuries are way up. I see probably 7 or 8 kids a day in a clinic in the spring who are overused throwing athletes who their shoulders are all beat up because they haven't done anything to prepare, and they've been playing all year round. So the USA Baseball Safety Board has recommended 3 months off of an overhead throwing sport for all baseball players.
Wow, I didn't realize that, because I was going to ask you. I mean, yeah, the different sports is one thing, but it seems like there's no separate seasons anymore. I mean, especially for baseball, it just went on and on and on. And parents, they just want their kid to keep playing the same thing over, which I feel leads to the overuse injuries and the burnout. I mean, a lot of kids, even my older son, they had scholarships for colleges, good colleges, and they ended up not going to play that sport, totally burnt out, done with it. So I think that's something for young parents to consider.
And that's a challenge because you want to, you feel like you're, again, guilty in some ways with some of the sports. We're a little bit more soft with our kids on this, but I mean, everyone doesn't want to get left behind. And so they're told, sold this bill of, you got to be doing this year round or your kid's going to get left behind. Well, the reality is when you talk to the majority of the St. Louis Blues hockey players, most of them played 3 sports growing up.
Okay.
And they all said, I was a better athlete because I played a different sport. And some of it is mental part of it too. Like I got done with hockey. I would go and I would play summer baseball or play tennis or something. And I was with a whole different friend group and I got my mind away from it. And when I came back to my sport, I was more eager and excited to get after it. I mean, we all feel burnout. I mean, going to work every day, doing the same thing over and over again, like we all get to the point where like, I need a break. Well, the kids are no different. In fact, they probably need more of a break than we do. So,
no doubt. What about resting their bodies too?
Exactly. Well, training different muscle groups. So you go back to the concept of training at a young age. So again, I don't think that working out, with weights is really a good training method for young kids. Really training different muscle groups by playing a different sport. So like go from baseball to soccer, do something completely different. So your movement patterns are going to be developing in a different way. And then again, sports are there's a lot of crossover. I mean, you still run in baseball, you still run in soccer, you got to use your legs, you got to use your hips, you got to use everything to generate power. All these things you can develop very, very well by playing a different sport. But I think the thing is, and I've had some patients and some conversations with families and some really insightful families too. I had one young man who was drafted and he had several injuries and he was, said, Dad, I think I don't want to play single A ball. I don't know that I'm good enough to make it to the big leagues. I think I'm kind of done with this. And his dad said, I think it crushed my dream more than it crushed his.
I think that's so true.
Yeah. So that's where you have to be careful as a parent is, am I pushing my kid because I think I love watching them play and I want them to be the best they can? Or is the kid pushing it to do it? If the kid's pushing it, they're probably okay. But when the parents are pushing it, I've never seen anybody be outstanding or excellent in something they didn't love doing. And if you're dragging the kid out on the field or on the ice or whatever, the kid, it's not in their heart. They're not going to make it to where you want them to go. So.
Well, I think that brings up a good point. I know with me, just seeing these parents in the emergency room and the urgent care, I mean, they have a fracture. They're going to be, well, when can they get back at it? It's going to be a while. I mean, and it was just like, well, can he practice this weekend or even a bad sprain? I'm like, they need to rest it, and I feel, you always think, oh, I mean, that's a lot on those kids, that pressure.
Yeah. It is a lot of pressure. And I use this COVID situation that we have right now to sort of, a lot of people have hit the reset button, and I've had a lot of friends who have said, hey, this has actually been an amazing time for our family to sort of reset and realize what's important. But again, it's not that sports are important. I think they're incredibly important. There's so many things that you can learn from playing with a team. life skills, how do you prepare? How do you challenge yourself? How do you
Mm-hmm.
compete? All those things are important skills to learn in life, but you got to keep it in perspective that the majority of the kids that are out there are going to be playing in high school at best.
Mm-hmm.
And again, if they're going to play beyond that, it's got to be in their heart. They got to be passionate about it. So.
Right, that's true. So what kind of overuse injuries do you see? Like, and how would you counsel parents or athletes with these reoccurring injuries?
Yeah, so a lot of it. So again, go back to not doing a whole lot of preparation for their sport. So I use baseball as an example. So, we see a lot of kids in their teenage years who go from football to having time off in the winter, and they go to play baseball. And for football, they're lifting weights and they're doing all these bench presses, and they're trying to build up their front muscles so they can fight the offensive lineman or the linebacker or whatever. Um, and then they come in with a bad posture. And so then they try to go throw a baseball and they've got such bad posture. And now next thing you know, they're hurting their shoulder because they can't get their shoulder around their chest wall.
Right.
So we got to really start thinking about how do we do a little bit of stuff to get our balance better, with our movement patterns. So again, I would say when you start getting ready for your sport, you got to think about what is it that I need to do to be successful at this sport. So if I'm lifting weights for football, I got to know what is important for football. But when I'm done with football and I go to lift weights for baseball, I need more flexibility. I need more, core strength. I need more scapular strength. So you got to start working on some of those exercises to gain that strength.
Mm-hmm.
So there are programs out there, and I think again, it's one of those things where you have to be careful about overtraining younger kids. But for the older kids, I think they can start to really do those things.
Mm-hmm. As far as if they're, we see this a lot on the sidelines. A child gets hurt in the game. What do you think? Usually it's the coach that gets to him first, or a parent runs out on the field. What are those key initial sideline assessments that you can tell, what is how serious it is, or what needs to happen at first on the sidelines for the initial assessment?
Yeah, I think the initial assessment, at least if I'm covering a game, the first thing I want to do is I want to get the athlete to calm down and be able to, obviously you see them rolling around in pain. Get them to take a deep breath and tell me, okay, what are you experiencing? What are you feeling right now? What part of the body is it? I mean, is your neck, is your back, is your knee? What is it?
Mm-hmm.
And then once they can identify what's hurting, if it's anything in the spine, if they have any midline tenderness along the spine, if you can poke on the spinous processes in the back that are sticking out, it's an immediate, call the ambulance and get them on a board. You don't want to take any chances. If it's their shoulder, you can usually feel deformity. If it's their knee, you can usually feel if it's really sloppy loose. If they can put pressure on it, that's usually a good sign if it's the lower extremity. But again, it's one of those things where you just kind of, take a deep breath, get the athlete to calm down, see if they can identify where it's hurting, and then kind of go from there. But usually the things that big problems are deformities. Like if something looks just, nope, that's not straight. Yeah, call the ambulance. Yeah.
Well, even the clavicle, I mean, that's not always real obvious break, is it?
Those folks can tell you where it hurts.
Yeah.
You can usually, in orthopedics, we typically will palpate the extremity. So for example, if it's the clavicle, we can just kind of push and say, where does that hurt? And if you just gently push there and it sets them off, or if you feel any sort of movement to the bone, then that's pretty obvious. And it's not terribly significant rocket science when it comes to return to play. I mean, the athletes can typically tell you, yes, I'm capable of being effective, or no, I'm not. So if you see a kid who's, say they sprain their ankle and you say, wow, is it okay to go back in the game? Well, if they're hobbling and barely walking normally, then probably not. But if they can do some functional movements and sprint and cut and turn, and they look like they're doing okay, then they usually is a pretty good indication they can go back and play.
So you think it's okay if they go back in then, if they can, bear weight?
Yeah. If they're functional, yeah. So you got to make sure you're not putting them back in the game in an impaired setting where they're going to get hurt worse.
Mm-hmm.
But yeah, if they're able to do what they're able to do and do it at a level that is going to protect them, and more importantly, they're going to be able to do it to help their team. So if the guy behind them is, who's healthy is better than they are injured, then they should probably be letting the guy behind them play. But so that's part of the thing where the coaches have to make that decision. But if they're capable of walking, capable of running, capable of pivoting, if they have protective strength, if it's an upper extremity problem, where you test their strength in this direction and this direction, and they're like, yeah, it feels okay. That's usually pretty safe.
Okay. Well, I remember a kid on our team got hurt, and you like knew right away that it was a growth plate injury in the ankle, and I was like, how did you know that?
Well, that was my kid. No, he was on the sidelines, and I could see him holding his hand funny, and the trainer was on the sidelines, kind of like poking and prodding on him, and he just didn't move his arm like he was supposed to. He was still protecting it, and so I walked down and looked at his thumb, and his thumb was tilted, sideways, and I was like, yeah, that's not right.
That's a problem.
That's a problem. So.
You're like, great. So did you tell him to get back out there and tough it out?
Oh no, we went. We went to our injury clinic. We have an injury clinic that's open in the evenings and in the mornings or in Saturday mornings for walk-in injuries. And so it happened to be on a Saturday morning. So I took him in, and I gave my son the choice of me putting the bone back in place or the doctor in the injury clinic, and he chose me.
Oh, wow.
Mostly so he could yell obscenities at me as I was doing it.
He felt way more comfortable with that.
Yeah, he felt way. Yeah, I didn't know he knew those words, but yes, he had a few.
That's funny. Well, let's talk a little bit about growth plates, because I know I hear about that a lot. And I don't know if people really understand what the growth plates are and why they're important, and when is it so more important than as they get older? They're obviously younger, but I mean, like, when can you not worry about it as much?
Right. So we talk about skeletal maturity or skeletal immaturity. So if you're a 10-year-old kid and you don't have any body hair, and your voice hasn't changed, you're likely to be very skeletally immature.
Mm-hmm.
And what happens is that you have little growth plates at the end of each of your long bones, and that's how the bones expand. So you have a little bone that's like this, a little growth plate that's narrow, and then you have the rest of the bone out. So if you this area is actually mostly made of cartilage, so it actually can shear pretty easily.
Mm.
So what we don't want to have happen is that kids get injured and they injure their growth plate. So we'll be a little bit more careful about letting kids go back on the field with ankle injuries and stuff like that if they're skeletally immature or look like they're skeletally immature, because if you keep pounding on the growth plate that's been injured, you can actually make the growth plate stop growing. And that becomes a big problem, because then the kids will grow angular deformities, and it just turns into a mess. So
it like stunts their growth in that extremity, right? Or in that area?
It can. The risk goes up with different types of fractures through the growth plate, but yeah, it's one of those things. If you're 10 or 11-year-old on a football field and you roll your ankle and you're sore on the bone, you're not going back.
Yeah.
But if you're 16 or 17 and you look like you're a grown woman or grown man, like, yeah, you're probably fine if you can run and pivot on it. So
yeah, there's different levels of growth plate injuries. I think that's a classification system with the Salter-Harris, where there's mild injuries and then there's all the way through the growth plate. Are those managed surgically, or does that just heal? It depends on the area.
Depends on the area and depends on how it's broken and if it's displaced. So
Okay.
if you just have a little subtle injury, we call it Salter-Harris type 1. You don't have to do anything to it. You just immobilize it till it's not painful anymore, and heals usually pretty quickly. If they have any injuries where things have broken and shifted one way or the other, then you have to actually put that back into position. Sometimes it'll hold itself back in position with just a cast. There are certain types of fractures, particularly around the ankle, that need surgery. But most of the time we can treat them non-surgically.
Okay. So for those that don't know, how long does it take for a fracture to typically heal? Is it similar in all the different areas, or is it different?
It depends on the bone. And if it's purely a growth plate injury, then those can be 3 to 4 weeks where they should be fairly well healed. If it doesn't involve the growth plate, you're looking closer to 6 to 12 weeks, depends on the person. So if it's me as a guy in his mid 40s who fractures his bone, he's going to take probably 8 to 12 weeks to heal it. If it's a my son, who's 14, he'll probably heal that in 4 to 6 weeks.
Okay. And also, what about which sport do you typically see more of those kind of injuries? The growth plate, is it baseball? Or is it
Uh,
all different?
yeah, so there's different types of growth plate injuries. There's like the kids who fall on their wrist and or their and have a true fracture.
Mm.
And there's some that actually have what we call a traction injury or apophysitis. It's where the muscles that attach to the bone, the growth plate still open, try to separate it and pull it off. So you can get those in the elbow and in the shoulder. It's a little bit of a different type of injury, but it takes us time to heal. So we call it little leaguers elbow. Those are the ones that we see in baseball players. But then the other ones are just like in the rest of us who, if somebody lands away and twists it the wrong way, we can break the bone that way too.
Oh. I see a lot of falling on extended hand, falling out on the extended arm injuries.
Yeah.
Yeah.
Yeah. That's more
adult
common. We see,
kids, really.
yeah.
Yeah.
Yeah. We see those injuries more typically in soccer and football, where people are getting tripped and they land and that kind of stuff. We'll see elbow dislocations in those sports as well. Baseball players, it's more commonly, the growth plate injuries are more commonly traction injuries from overthrowing, where the muscles are repetitively pulling on the bone.
So I thought I would just kind of start with the shoulder as far as common injuries. What's the difference between like an AC separation and an actual dislocation, shoulder dislocation, as far as like emergency, urgency, management differences? Because it's quite a big difference there.
Right. So AC separation. So, I don't know if you can see this here on me, but if you have the collarbone coming right here, and here's the acromion. So the acromioclavicular joint is right there. And so those, if you point to the top of the shoulder and right on that joint there, that's the AC joint. So when somebody lands on their shoulder and their shoulder gets pulled down, the ligaments between those two bones get injured. And then if it keeps going, the ligaments that go from this bone up to here can also get injured. So that's our AC separation. And a lot of times you'll see the clavicle look like it's sticking up. It's actually the shoulder girdle pulling down more so. But that's an AC joint injury. A shoulder dislocation is actually the shoulder joint that pops out of joint either front or back. And that's a completely different injury, completely different problem. AC joint injuries typically heal without any issues. You have a whole hockey locker room at the Blues full of guys who've had AC joint injuries. They look all deformed, but they're no pain and they're looking, playing fantastic. Shoulder dislocations, though, that can be a challenge because if you can't keep your shoulder in the socket, and particularly in a contact sport, then that's very disabling.
And then surgery and maybe not play anymore after that. If it keeps popping out, is that true? If it happens once, is it more common to happen again?
Yeah. If it happens once, depending on the study that you look at, there's a study out of West Point where they had all the West Point cadets and they looked at the shoulder dislocation recurrence, and it was somewhere close to 90% popped out. But those guys are doing more rigorous contact, athletic activities. The general population, it's probably closer to 50% if you look at all comers. But if you usually stratify according to activity level and the type of sport that you play. So if you are a tennis player, you're probably going to be a lower risk. If you're a football player or a hockey player, you're going to be at a higher risk just because of the contact. But yeah, and typically there's a little bit of controversy about, do you fix first-time dislocators? And the answer is you probably need to treat everybody's situation more so than the injury itself, unless they have a big fracture that needs to be fixed.
Mm-hmm.
But yeah, I think, again, if somebody's a high-level contact athlete, we'll be a little bit more aggressive, assuming that they want to go back to that activity.
As far as mechanism of injuries, as far as if someone comes in and they're having anterior shoulder pain, is that most of the time from being tackled or getting hit while in that process of throwing?
So
is it from injury, usually from the interior shoulder, is it most likely from injury?
So it depends on the sport. So if somebody gets a direct contact there or gets their arm pulled behind their back as they're trying to tackle somebody, that kind of shoulder pain can be related to some subtle instability or frank instability.
Mm-hmm.
If it's a throwing athlete that gets sort of that anterolateral shoulder pain right through here, that's typically from scapular posture. and
Okay.
repetitive lifting. So if I pull, I'm going to do this. If I pull my shoulders, I don't know if you can see this at all. If I pull my shoulders all the way together and I don't pull my shoulder blades back and I try to throw, that hurts right there because I can't get my arm back. If I simply squeeze my shoulder blades together, now I'm putting my arm in a more functional position.
Mm-hmm.
So that's a little bit of an exaggeration of what actually happens. But if
Mm-hmm.
you get a little bit of a forward posture as a baseball player and you start doing that motion repetitively, it basically just rubs a blister in that spot in the bursa and starts to hurt. So again, if you have a traumatic injury where your shoulder pops out of joint or it gets pulled the wrong way, that's more of a labral problem. If it's more of an overuse throwing injury, that's usually from scapular posture.
What about the bicep tendonitis? Can you show me where that's at? I think that's important to know because a lot of people, athletes have that, don't they?
Yeah,
I think that might be what my son's problem is.
so biceps comes right up and through here. So if you can feel the bone right there,
Mm-hmm.
and then just kind of fall right into the other bone right there, you can roll your finger over a little groove, and that's where the bicep sits.
Okay.
And so anything that kind of comes up and through here is now biceps. So rotator cuff or bursal pain is just kind of out here.
Mm-hmm.
Um, Shoulder pain can often be kind of deep inside back here, like shoulder joint pain. Biceps pain can be up in here, but there's some crossover with bursal pain. And then obviously up here, we talked about the AC joint. So kind of
Mm-hmm.
where does it hurt kind of dictates what we think
Mm-hmm.
is going on there.
Mm-hmm.
So that's one of the things I tell our residents when we're teaching them how to make a diagnosis in clinic. I say, okay, your first thing is how old is the patient? Because a 55-year-old is going to have a different problem set than
Mm-hmm.
a 17-year-old for the most part. And then once you establish their age, you say, okay, point with one finger where it hurts the most. And usually patients will tell you one of those spots. It's like, oh, it hurts right here. And if automatically I'm thinking AC joint problems,
Mm-hmm.
it's killing me over here. I'm thinking that's bursal or rotator cuff problems. It's killing me in the front. That can be biceps, but also could be bursa, or it's kind of deep in the armpit or in the back. And I'm thinking shoulder joint issues. So it's pretty easy to kind of sort out where things are probably coming from just by using those two pieces of information. And then
Mm-hmm.
you got to focus on, hey, what did you do? Well, I fell and my shoulder popped out of joint. Well, that's a pretty easy diagnosis to make.
Right. Right. Whereas overuse, in the older population, you got to think, what do you do for a living? What's your occupation? What are you doing all the time?
Right.
Is the posterior shoulder pain more common in older people, not really associated with injury, or do you still see that with injury?
No, we still see it with injury. Yeah.
Okay.
So if you labral tears in the back of the shoulder, often with offensive linemen, football players who are constantly getting their shoulders pushed back as they're blocking, can put a lot of tension on the shoulder. People doing a lot of heavy weightlifting, again, that mechanism of pushing the shoulder back as they're lifting. We'll see throwing athletes will get some of that too. Again, if they've got a bad scapular position, they can pinch the back of their humerus up against the back of the socket. Because if they're back here, you can't get any more movement through the joint without getting the shoulder blade around. So they just repetitively kind of pinch that shoulder up against the back of the socket, and that can cause discomfort in that location as well. So,
Well, what do you think is going on if, like just take with baseball, every time they throw, they're having that pain. And, like with my son, he has that and he's a catcher and negative MRI, but yet he goes to throw. I would think if it's like a tendonitis or an overuse thing, how long does it take for that to go away? And does it start back up the minute you start throwing again?
That's a great question, and it kind of depends on what the source of the pain is.
Mm-hmm.
But yeah, there are some people who can't get over the hump without having some sort of intervention. We try not to operate on throwing shoulders because the data is a little bit all over the place in terms of how predictable it is to get them back to a high level of throwing. Again, the majority of people who have throwing shoulder pain, it has something to do with the movement patterns more so than it does anything structural. So, and it's not uncommon to see a patient have a normal MRI but still have pain with throwing. And sometimes it's imbalance of the shoulder blade muscles. Sometimes they can get some thoracic outlet symptoms where the muscles in the neck and across the chest wall right here, they get so tight that they start to push on the nerves and the blood vessels. And that can often cause some pain down through here. We call that thoracic outlet syndrome.
That's pretty common, isn't it?
it's it's more common than we like because that's a challenging problem. Yeah,
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 yeah, because I think that is pretty common.
yeah.
Um, well, let's switch over to the knee.
Mhm.
How would somebody know if they had an ACL tear? I mean, you hear it all the time. So could you tell me, like, for the average person, where is the ACL? Why is it important? And how would you know if you tore it?
Yeah, so the ACL, if you think of the knee as having four ligaments, the inside of the knee and the outside of the knee are the collateral ligaments, and those are the ones that kind of keep the side-to-side movement from happening. And on the inside of the knee, there's two ligaments that kind of cross like this, that control the front to back movement, but also the rotation of the knee. And so the ACL is anterior, meaning the front of the knee. It
Mhm.
goes basically from the tibia to the femur, sort of in the center of the joint. So ACL injuries aren't subtle. Again, in the shoulder, for example, there's a lot of diagnoses, differential diagnoses, as we say, for older patients, and relatively fewer differential diagnoses for younger patients. So a 17-year-old really only has like three or four things that typically happen in the shoulder. A 55-year-old is going to have like seven or eight things that are possibilities. It's exactly flip-flopped in the knee. So the knee in older people, it's likely going to be arthritis, a meniscus tear, some sort of kneecap pain. In a younger person, that's when you think about ACLs and patellar dislocations and, osteochondral injuries and, LCL and PCL, like
Mhm.
all these other things that happen, because those things more commonly happen from high energy or even low energy sports activities. So when you tear your ACL, it's typically most common mechanism is you plant to change direction and your knee shifts, you feel a pop, and the knee buckles and gives out.
So it's it's unstable. You probably won't be able to bear weight.
Sometimes you can bear weight. You certainly, if you can go back and play the same game, it's probably unlikely that you tore your ACL.
Okay.
But if you think about the femur and the tibia and the tibia going back and forth like this and rotating like this, what happens when the ACL tears, the tibia kind of does that and slides out. So the ACL does one of those things and pivots back in, and that's what usually gets it.
And what's the
Um,
management?
Yeah, so initial management is trying to get the knee swelling to settle down, and also to get the quad muscle firing again. Because if you go add a second insult to an acutely injured knee like that, you're setting yourself up for a higher level of stiffness. So we typically give people about 3 to 4 weeks of ice, compression, quadricep strengthening, trying to get that knee looking fairly normal, so that when we go do a second insult to the knee, it's not going to have stiffness and worsening pain and that kind of stuff. It's an uphill challenge when you have to operate on ACLs early, trying to get the people to rehab effectively right after the injury.
Are they often able to go back to that sport, or is it a high likelihood of re-injury with an ACL?
Yeah, it's a great question. So we know that the majority of people who have ACL tears, on occasion you'll find somebody who's able to compensate and do well without an ACL, but the majority of people who play a pivoting, twisting sport, soccer, basketball, football, will need their ACL fixed. The largest study of over 1,500 patients in the country show that the return to football and soccer is just under 70% to the previous level. So it's not a perfect operation. Now, in that subset, one of the biggest reasons why they didn't return to their previous level of sport was fear. So,
That makes sense.
yeah.
I mean, even in young people, I know with old people, just taking a fall. I mean, so I can see that as well. Like, is it going to be the same? Am I going to be able to do this?
Mhm.
That makes total sense.
Yeah, they don't want to have to go through the process again. So, they're like, all right, it's not that important to play. Some of them, it's their senior year of high school and they're not playing college sports. And so there's a little bit of, um, it's not totally clear why it's not better than it is, but 70% return to play is not 100%. So
Yeah, and that's a big deal when it's you,
yeah,
and you love
exactly.
the sport.
Yeah,
Yeah.
and it's a long recovery time too. And what happens is not only do you have to get your strength back, and you have to have strength that's close to the other side, because you'll notice the asymmetry. If you've got one side of your leg is weak and the other leg is strong, it's not going to feel normal. So
Hmm.
regaining the strength is a big part of the ACL recovery. But there's also a maturation process that happens when we take a piece of tissue from one part of the knee and we put it in a new part of the knee. It's now doesn't have its blood vessels, and the nerve supplies are all cut off from what they're normally used to be doing. So all those blood vessels and nerve fibers have to regrow into that graft. And that maturation process takes a minimum of 6 months. But we've also seen some data that we're studying right now that's shown that up to a year, people still will regain their ability to feel where their knee is in space. So we have a test that they can, they get better at 3 months, they get better at 6 months, they get better at 9 months, 12 months, and it sort of flattens out in terms of improvement, which is actually kind of correlates to what, people say. I trusted my knee more the second season back than I did the first season back.
Mm-hmm. Is that surgical repair with their own tissue, or, you said graft?
Yeah, so we try to use, in younger, more active people, we try to use their own tissue. Again, that same large series of patients, if you use somebody else's tissue, so a cadaver, we call it allograft, your failure rate was 4 times higher than if you used your own tissue. So somebody in my age group who kind of does some athletic activities, mostly running straight ahead, but not playing high-level soccer or whatever, my risk is pretty low no matter what the graft is. But if you're 17 and you're playing soccer or football or volleyball 7 days a week and you have a graft that might be a higher risk of failing, we typically use your own tissue. And the failure rate is all comers around 7%, but it goes up substantially in the younger, more athletic population because their exposure to things that tear ACLs is going to be higher.
So the ACL is a big deal.
Big deal.
How do people prevent that? Is it strengthening the quadriceps, the IT bands? What is it that prevents this in the first place?
That's the $1 million question.
Okay.
Yeah,
At least it was a good question.
There's a lot of research going into how do we prevent ACLs, but so far we don't have great data. Some people, are toying with a jump landing program. The ACLs are more common in females.
Wow.
And there's some data about, the menstrual cycle. There's a little bit of concern about, certain parts of your menstrual cycle, you might be more prone to having your ACL tear. The clearest data, the most obvious, is that as we've gone to sports specialization, the incidence of ACL tears has gone up. So again, I think there's a fatigue component to it that contributes to it. And whether that's a fatigue in the muscles or a fatigue in the actual tissue that, just like a tennis elbow, a degenerative process that happens in the elbow from playing too much tennis, maybe, we don't know that for sure, but maybe there could be some degenerative process in the ACL as well.
Makes total sense, and it's really good for parents to realize that as far as redoing those repetitive sports over and over again. That's true. That's huge.
Yeah.
So let's talk about ankles a little bit. I know there's different levels of sprains. Could you just, differentiate between a sprain and a strain, and how you would manage, a stage 1 or a stage 3 sprain, the difference?
Yeah. So we typically think of sprains as a injury to the ligament, and strain being an injury to the muscle. So again, the mechanism of an ankle injury really kind of determines what our concern is for whether or not that's going to be a long problem. So our standard roll your ankle, where the ankle kind of rolls in like this and they, hurt mostly on the outside. That's you can grade them according to how much looseness to the ankle, but that's usually going to be a rehab issue that's going to take anywhere from a week to 4 weeks for most people to get better. We try to rehab folks fairly aggressively with those type of lateral ankle sprains, simply because we want their muscles to work efficiently to try to protect the ligaments as they get back to athletic activities. We probably let them go back sooner than the ligament actually heals. So we want to make sure that their muscles are working really well. I was giving talks in Tokyo, Japan, as part of a traveling fellowship for our sports medicine society. And they were working on it was Hong Kong. And they were working on a sock that you could wear that when it's sensed the ankle starting to roll, it would zap the muscle to pull it back.
Wow.
So, and that's an expensive sock, and I don't think it's
no doubt
market, but
pretty cool though.
It's kind of cool. But the concept is what they're trying to do is trying to activate the muscles quickly so that when the ankle does start to roll, that your mind, before you even think about it, pulls back.
Mm-hmm.
So that's what the rehab process is designed to do, is try to get those muscles activated to protect the ankle. So that's a basic lateral ankle sprain is our most common by far. If somebody comes in and it's really swollen and it's already bruised and they're having difficulty weight bearing, always get an X-ray just to make sure that they haven't done something more substantial.
Mm-hmm.
And then usually put them in a boot for a couple of weeks just to let the soft tissue cool down, give them a little extra support, get them started in therapy, and then kind of get them going from there. And again, it can take anywhere from a week to 4 weeks. And on occasion, you'll get somebody that lingers longer. The more concerning ankle sprain is a high ankle sprain. And that's one where the foot, instead of rolling in this way, rolls out. And so it then starts to separate the two bones from each other. Mm-hmm. And we call it a syndesmosis injury. So the ligaments that go between the fibula and the tibia get disrupted. And those are really hard to predict when they get better. We see some really nasty, we see this in hockey quite a bit, some really nasty swollen ankles and they can't bear weight. And 2 days later, they feel great. I want to play. And we see some really pretty mild looking stuff and it's 3 months and they still can't play.
Wow. Are you talking about the inner part of the ankle as opposed to the outside? Or are you still on the lateral?
So syndesmosis would be sort of the center. So if you, I'll see if I can. I don't know if you can see that at all.
Yes.
This would be the outer ankle.
Yes.
And then the syndesmosis is going to be kind of right in here.
I see that.
Yeah. So right between the two bones.
And what about the inner? Because aren't the ligaments on the inner portion of the ankle thinner, or, really, as far as like managing conservatively, just like with me, primary care, as opposed to who needs to see you when when something like that happens?
Yeah. I think if the mechanism of injury is an external rotation injury, and their x-rays are normal, I would still have them see an orthopedist.
Okay.
If their mechanism of injury was they rolled their ankle and it's a lateral ankle sprain and the x-rays are okay, I think you can, treat them like a standard ankle sprain and rehab it and ice. And then usually if they're not getting better after 6 weeks, we get a little bit more aggressive about trying to figure out why they're not better. But usually a standard ankle sprain will get better. And again, somewhere between a week to 4 weeks.
So I had 2 people yesterday. I want to see how common this is with talus fractures. Is that common?
That's why you get the x-ray.
Yeah. I mean, it was weird because I still think they had a sprain in the ankle because the ankle is extremely swollen and it was the similar mechanism. But then, yeah, I was like, I thought that was more of like a stress fracture maybe, or, honestly, I didn't really know how to splint them well. I thought, well, I hadn't seen it very often.
Those kinds of injuries, if you get a talus fracture, you need to get them to see an orthopedist right away. Keep them non-weight bearing. Sometimes we'll put them in a big splint for that. Yeah, and again, that's why. So the mantra in orthopedics is everybody deserves a normal X-ray. We get X-rays a fair amount, and sometimes patients ask why, and I said, well, because we pick up the things that we need to know to treat right away with X-rays. And on occasion, we'll pick up you got a tumor in your bone, and it's not an ankle sprain. You just happen to get an X-ray, and oh my God, you need to have that evaluated. So that's the stuff we want to know about sooner than later. But yeah, if you didn't get your X-ray, you wouldn't know that you had a talus fracture that you needed to be non-weight bearing on, and some of those require surgery as well.
Okay, wow. Well, let's just shift a little bit about runner's knee. Even in young athletes that run probably deal with this, as people like me that deal with this. How do you manage runner's knee? And is there a certain area that's considered runner's knee, or is it, mine's more on the inner knee?
Yeah, so the classic runner's knee is in the kneecap area. And that can most commonly come from just the tracking of the kneecap not being perfectly flat. Sometimes people can get some tendonitis if they push on the bone just at the lower portion of the kneecap where the tendon attaches. That if that's sore, that's more like patellar tendonitis. If you're having pain, sorry.
Is that you? Okay.
That's me. Sorry. Trying to decline that. So if the pain's more on the inside, we worry about meniscus. If the pain's on the outside, that can be meniscus. That can also be IT band friction. So if you have a tight IT band, that can start rubbing on the bone there. So, but if you're running and most of your pain is on the inside of your knee, particularly if it swells, that's more concerning that you have a meniscus tear or
Is that something
arthritis.
that, does that heal? Like, I think I remember, like, if it lines up right, it's going to heal, as opposed to, it's more like from, isn't that, I was thinking meniscus is more from like twisting, but no, it could just be from running.
This can be from running, yeah. Meniscus tears happen, more commonly in younger patients. We see it with twisting, but over the age of 35, there's a whole lot of people who come in with meniscus tears that just kind of started hurting when they were running. It's a little bit of a degenerative process in the tissue. As you get older, the water content changes in both the cartilage and the meniscus, and it just makes it more prone to injury. And so,
which is another reason to stay hydrated.
That's a good reason to stay hydrated. I'm not sure how much the hydration affects the meniscus itself. I think it's just more of a degenerative process that develops, and how well the meniscus holds its water content. But it's a natural thing. And the unfortunate part about meniscus tears is that they're also often sort of an early sign of that the knee is starting to have some degenerative changes. And so again, the analogy is once the train leaves the station, we have no idea how fast it's going down the tracks. So that's the biological process that we can't control. But and we usually, when we have patients that come in with meniscus tears, we catch them at one point in time in a process that's more of a continuum. And so it's really hard to bat arthritis in a short period of time and who's going to just be fine and do well for 10 or 15, 20 years.
So I think I was reading, like, as far as runner's knee, it said not to wrap it or put a sleeve on it. Is that right? Or do you?
Yeah, I think it's not going to help the tracking. So say it's your standard kneecap pain or patellofemoral pain. That's usually a problem that starts because you have weakness in your core and gluteal muscles. And what happens is that you get a little bit of that knee dipping in every time you take a step, and the kneecap needs to be doing this to distribute pressure over a large area. And if your knee is dipping in, your kneecap then starts to edge load. And muscle will oftentimes kind of pull it over, and instead now distributing 6 times your body weight over this amount of space versus this amount of space.
Oh yeah.
And then so that point pressure that develops really makes it uncomfortable. So for runner's knee, and honestly, runners really don't like to stop running. And so we spend a lot of time trying to counsel patients on why the therapy is really critical for this and why you have to do it for 3 months to really correct the problem. And having had that myself, it's really frustrating. You want to be active, you want to do things, but your knee is keeping you from doing it. And then you get, some people request an MRI, and very rarely do we find something that's really significant if it's mostly kneecap pain. And it's frustrating because it still won't get better unless they do the exercises.
So strength training is huge.
Yep, and gait mechanics, and sometimes we'll send them to a running clinic to have them watch how they run, see if they can pick up on some abnormalities in whether their stride length is off or whether their shoes are not fitting right or whatever. But it's, again, long distance running, our bodies aren't really designed to do that. But it's one of the favorite things that people do.
I was going to ask you about that as far as shoes go. I mean, what kind of shoes, is there a certain type of shoes that are really better, or does it just depend on the feet? Is there a certain, I think I was reading like soft soles are better, or, you hear all different things.
Yeah, I think there's a lot of, there was this trend back about 10 years ago where they were using just the sleeves or whatever, like those toe shoes. I can't remember. Yeah. There's a book that came out about talking about, I think it was Kenya, the people ran without shoes. And so they went to this snowshoe running style, and we saw so many injuries from that. But no, I think the number one thing is just knowing whether or not you pronate or supinate. And if you go to a good running store when they watch you run, if you go to get your standard off the shelf, running shoe, and you don't have somebody watch you run, you might get lucky and find the shoe that works for you. But you really should have somebody watch you run and walk from behind and make sure that your foot's not, either pronating or supinating, and then get the right shoe that supports your tendency so that you can get good support.
I wondered if there was something too that I heard the running stores do that, but I didn't know if there was really anything to it, but that's good to know that it really does make a difference.
It does. And the shoes companies design their shoes to be for pronation or supination of the foot. So if you're somebody who overpronates and you get a shoe that puts you in more pronation, you're going to end up having problems. Mm-hmm. So you need to make sure that somebody's getting that foot balanced as you're running. And then once your foot's balanced, now that's not the only part of it. Once your foot's balanced though, then it's a lot more energy efficient when you're running. The bigger issue for a lot of people is they have weakness in their gluteal muscles. So when you go to stand on one leg, the muscles on that leg in the buttock have to actually contract to hold your pelvis level. So if these muscles I'm standing on this leg don't hold me up, my pelvis will tilt. Now my center of mass will tilt. Now I have to do something down below to get recentered, and that usually means you're dipping your knee in. And so if you're dipping your knee in and tilting every time you take a step for 4 or 5 miles, that's not good for you.
Are lunges and squats a good thing or no?
Yeah, I think it depends on the person. I typically like bridges and planks and stuff that really engage the entire core.
Okay.
And then clamshell exercises where you're just basically rolling your hip out to the side. Again, sometimes you can put a little ankle weight on it, but like imagine lying on your side in a fetal position and then just trying to roll your knee up toward the ceiling. Okay. That's a clamshell.
Okay.
So simple things just to get the glutes engaged. Yeah, and for most people, if you are having knee pain related to running, it's probably worth having a physical therapist work with you, because most people are not strong in areas that they didn't know they weren't strong in. And some of these exercises can be very challenging to do correctly without having a therapist show you how to do it correctly. And once you have it, go in the right direction, it's just a matter of doing it. And that is also a challenge because a lot of people don't like doing their exercises, but especially if they're not good at it.
True. So I learned I need to probably see a physical therapist. Okay, well, back to, let's just talk a little bit about prevention of injuries in sports. What do you think? Does nutrition play a part? I mean, what is the big thing with injury prevention?
Yeah, you're going to kind of think I'm weird for this. Sleep, being well rested, being mentally focused, being smart about your training. Again, most people fail in their exercise program because especially as they get to be our age group, where you don't always have enough time to get out there and prepare, but you want to still be like your 20-year-old college athlete who can just run out and do it. Just don't beat yourself up over the fact that you need to maybe do less weight, or maybe run a little bit less and maybe walk sometimes instead of run, mixing it up a little bit. I use the best thing for people I use is just be smart, just don't beat up on yourself if you can't do what you used to do.
So sleep is probably key for the young and the old.
Yes. Sleep is huge. Sleep and hydration are probably the two biggest ones. There's a lot, the nutrition side of it, I think, is pretty simple. Most of us know what makes us feel kind of sluggish and heavy. And if you're going to go work out and you want to be mentally prepared and you want to be feeling sharp, you probably shouldn't eat a big meal 2 hours beforehand. But you need to have nutrition. You should be eating. Where we get into trouble with a lot of younger athletes, especially young women running long distance sports or something like that, they get into the menstrual cycle problems. They get into eating disorders that they don't get enough nutrition. Not that they're, anorexic or bulimic. They're not matching their output for the exercise that they're doing. It does happen in men as well, but we certainly see it more commonly in women. But just matching the output of what you're doing. I mean, you got to put enough food in your body if you want to stay active. But yeah, I mean, for me, it's hydration and sleep. Those are the two biggest things that you help yourself be better with.
Which young kids need to know. These kids, especially with all this lack of structure, wanting to stay up all night,
Mm,
So yeah,
me
sleep
too.
is huge. So what do you recommend for all these young athletes that want to maybe play for the Blues one day? I mean, what do you say to them?
Um, so I would say if you're if it's a passion of yours and you want it and that's all you ever think about is doing that, it just doesn't happen. You have to go put the work in. And that's no different than anything else that you'll ever do in your life. If it's something that you want, you got to go put the work in. It just doesn't happen waking up and getting out of bed in the morning. If you are feeling like you're getting pushed to be the next best thing, but you're not really passionate about it, you need to speak up and tell your parents or your coaches or whoever's pushing you, this isn't what I want.
Mm-hmm.
Okay? Because you got,
That's good.
for the majority of people, the sports are for the social side of things. It's to be around their friends. It's to have an activity. It's to compete. It's to get exercise. And I'm not disregarding, the level of sports, and that's a critically important thing,
Mhm.
no matter whether you're playing recreational sports or whether you're playing pro sports. It's the camaraderie. It's the stuff that makes all this worthwhile. But
Mhm.
if you're really passionate about something and all you want to do is do it, then I would say number one, put the work in, and number two, get your education, because you're one injury away from not being able to play your sport.
That's
Um,
true. That's
so,
true.
and there's plenty of people who can get an education and still be very, very successful at their sport. But
Hmm.
say you're a scholarship athlete to go to a Division I school, like maybe say they're going to Alabama to play football, and this is your senior year of high school, and you blow out your knee. You're not going to Alabama to play your football anymore,
Right.
right? So what are you
Right.
going to do? So
Right. Yeah. Education's huge,
it's
and learning to be a good teammate.
learning to be a good
I
teammate.
mean, that's
Exactly.
huge. I
Yep.
mean, in this self-centered world, it's important to learn how to be a good teammate, you know,
Mhm.
learn to build each other up. So I'm going to have a couple fun questions with you, and then we'll be done. So, is there a sport that you would not let your twin boys play?
No, I don't think so.
No?
People ask me all the time about football. I played football. You know, I think football has its downsides, but there's just as many. I wouldn't say just as many. There are plenty of injuries in other sports that
Mhm.
come close to the number of injuries that we see in football. Um, I think whatever they love doing, and so I use again this whole COVID thing as an example. One of my sons is he plays soccer, and we love the team that he plays with. He's got a fantastic coach who gets it, and he treats the kids well, and he understands how to push them, but also understands how to back off. And
Mhm.
that's all he's really done. But we discovered in the COVID, when he couldn't really play with his friends, that, oh, by the way, he loves playing basketball. He has been out 3 hours a day shooting basketball. He
Wow.
would never have known that he loved basketball had
Right.
he not had the ability to step away from soccer for a little bit
Hmm.
and work on something different. So I think it's really critical for kids to discover what they love and what they're
Hmm.
passionate about. I think that's really important.
Well, I think that's good to hear about football because my son Brett plays football, and I've been judged for that, and that's coming from somebody that, I'm in the urgent care, I've been in the ER, and I mean, I still let my son play football. I mean, he loves it. So,
Right.
I mean, so you got to be safe, you got to be ready, you got to do all those things that you talked about.
Well, and I'll say some of the stuff that where I am today because of um, um, the work ethic, the stuff that you had to do, the hard summer 2-a-day practices, the heat, the contact. Some of it's painful, some of it's exhilarating, but football was the one thing that allowed me to get through some of the hardships of doing residency. Like you learn how to persevere through struggle and pain I'm sure I have some injuries that I wouldn't have otherwise had. But you know what? Most of my injuries came playing basketball.
I was going to ask you which sport you see the most injuries with.
Uh, we still see the most injuries with football, uh,
Okay.
but
Not
but
hockey?
but no, hockey's not actually surprisingly as bad. I mean, there's still concussions that happen through hockey.
Mhm.
Um, but honestly, the data says that football is probably the most injuries overall. But honestly, the surgical procedures that I do are primarily on soccer players.
Oh, okay.
We see football players, some they have significant injuries, but we see a ton of soccer players
Wow.
with knee injuries. So
The knee,
yeah,
yeah.
knee injuries, and
Which
then
kind of, going through life, injuring it early, I can see that that could be a problem.
yeah, that's going to be we're going to have a challenge. We're going to have a lot of people who are with the ACL injuries that have happened. I mean, we're skyrocketing over the last 15 years, and
Wow. Well, they're playing all the time.
all the time.
Yeah. Yeah. It is crazy the way that sports have been. I know Joel's friend, he plays with the pro level, with soccer, and it's constant,
Yep.
So, well, awesome. Thank you so much for talking with me. I learned a lot, and I'm sure everybody else did too. So thanks for being with me.
My pleasure.
All right.
Be safe and tell your family I say hello.
Okay, I will. Thank you.
Well, take care.
Bye.